Well, there we go. Welcome, folks, to Indaba, Africa. It's Chris here in central Pennsylvania, and we are just moments away, approximately 3 minutes, from a 21-day national lockdown across South Africa, an unprecedented, unparalleled event, an effort by President Cyril Ramaphosa to stop community spread, halt it in its tracks as the COVID-19 virus, the Wuhan coronavirus, takes hold, sadly, in southern Africa. President Ramaphosa announced earlier in the week that he would be imposing a 21-day national lockdown across South Africa. And here we are, just moments away from it. So, what do we got to say about this? Well, for starters, this is going to be something that we've never really seen before. We'll see how it goes. But as the South Africans move quickly to their homes, their abodes, no matter where they live, across the country, here in just moments away, 2 minutes now, 56, 57 million South Africans will take unprecedented action as they stay home. The only exceptions, of course, to this would be things like first responders, emergency services, essential key personnel. Amongst them, you would see, of course, the military, SAPS, South African Police Service, medical professionals, doctors, nurses, healthcare providers, pharmacy workers, emergency services like fire departments and such. And of course, other essential workers, which normally people don't think of as being essential workers, folks who work in the grocery industry, for instance. South Africans need access to food, resources, and so those folks are also key and essential workers. So here we are. We are now just 1 minute away from a 21-day national lockdown across South Africa. Our hearts and minds go out to the citizens and residents of South Africa as you take on this challenging situation. Hopefully, this won't damage South Africa's economy so severely. It's already suffering immensely from questionable macroeconomic policies and challenges, and of course, some legacies of apartheid that the country still deals with 26 years after the end of that system. But here we are, just a matter of moments away, moments away. It is now midnight in South Africa. The zombie apocalypse has begun. South Africans find themselves now confined to their homes, their abodes, unable to leave for 21 days. This includes bans on dog walking, public exercise, things like that. The government has told South Africans that they can exercise, but in their homes. Those with spacious, luxurious homes and recreation equipment may not find it to be that great an imposition, but the vast majority of South Africans who would want to get out to avoid going stir crazy are going to find that to be quite a challenge. So the South African National Defense Force has deployed to cities and residential areas, as well as the highways, to augment the South African Police Service, SAPS, to help them control and prevent the movement of people who are not authorized to be out on the street. The 21-day national lockdown in South Africa begins now, midnight, the 26th of March, turning the 27th of March now, until the 16th of April. South Africa's unprecedented action is a little bit different than other places. Zambia also begins a 14-day lockdown tonight. And some parts of the United States already experience a lockdown. For instance, California. In New York, the state of New York is under a lockdown. This is understandable given that New York City and New York State is in many respects the epicenter of the Wuhan coronavirus, or COVID-19 by its scientific name. We have nearly 34,000 confirmed cases of the virus in New York, and about another 7,000 just across the Hudson River in New Jersey, bringing the total of those two states that border each other to over 40,000, or approximately 50% of the total confirmed cases of Wuhan coronavirus, COVID-2019, in the United States at the moment. President Donald Trump's action encouraging people to stay home and shutting down many parts of our economy hopefully will have the effect that's desired. We do not know the end date for that, but it is not a national lockdown. And you can see that here in central Pennsylvania, where we have only a handful of cases. And for the most part, people are behaving well. There's very little hysteria here, and the shelves are full. People aren't going about their normal business. They are heeding the government's requirement or request that they not go out to places, but that has been enhanced in the last several days as last Friday, Governor Wolf here in Pennsylvania ordered the shuttering of all non-essential businesses. So restaurants are shut down, although you can get takeaway from most restaurants. Bars are also shut down and other locations, outdoor places that you just can't go to. Of course, sporting events have long since been canceled or postponed to an indefinite date in the future. As we sit here with a sports-free environment in the United States and around the world. Obviously, as you can see, I'm a rugby fan. I'm going through a bit of rugby withdrawal right now as we've lost all of rugby, Six Nations, the HSBC 7 Series, the America's Rugby Championship, which is scheduled for later at the end of the summer. Wonder if that's even going to happen. The Sevens Olympics is now gone as Tokyo is postponed probably until a year later in 2021. Here in the United States, MLR, or Major League Rugby, has canceled the rest of its season, leaving the San Diego Legion at a 5-0 undefeated record as ostensibly the champions for this season, breaking Seattle Seawolves' first 2 seasons as champions. I wonder how we'll count that in the history books, but we'll see at some point. As we lose these sports competitions and folks deal with this horrific global situation, let's think about our friends in South Africa who are now in the grip of a 21-day national lockdown across South Africa. Unprecedented territory. In many respects, a black swan event, the epitome of a black swan event, an unanticipated, unplanned for event that shakes us to our very foundations. It's interesting, as we've seen multiple pandemics and outbreaks of viruses and other illnesses over the past several decades, none has ever had the impact from a standpoint of shutting down the globe, shutting the world's transportation networks, its economy, human interaction, shutting people off from one another. At this point, we've surpassed the 500,000 mark globally for people with confirmed cases of the illness, both those ill, those who passed, unfortunately, and the smaller number, about 20%, who have recovered from the disease now, or from the virus. But in South Africa, as we sit here this evening and tonight, across South Africa, whether you're in the Western Cape or you're in Gauteng, Limpopo, KZN, the Northern Cape, Northwest, the Free State, wherever you find yourself, in Mpumalanga, a toast to South Africans, whether you're in South Africa, living with the lockdown, or you're anywhere around the world, somewhere in the US, the UK, Australia, New Zealand, wherever you are. To all South Africans, I raise a toast to you and wish you the very best as you confront this lockdown. So as the lockdown approached, there were a number of people, of course, who were wondering what exactly it meant across South Africa. The transport minister came out yesterday, I believe it was, or perhaps the day before, and made it clear to South Africans that contrary to what some people thought, the country, in fact, is very much under a serious lockdown. And by that, I mean that all transportation is essentially halted. No combis, no scheduled bus routes, no long-distance trains, no long-distance buses. All of those functions are shut down, which of course means that if anyone needs to make a visit, an authorized visit for an emergency, or to do basic shopping that is allowed under the lockdown, for a lot of folks, that's going to be a real challenge. A fair portion of South Africans get around the country and do their business with the only means of transport available to them. And what is that? Combis. I remember the first time I ever went to Pietermaritzburg in KZN, and I went to see the Gandhi statue that's there and see the government buildings in the center of town, which are very interesting color there. Fascinating. Gandhi served as a barrister or attorney there, as I understand it. But when I went there the first time, the thing that I found most remarkable about Pietermaritzburg is just down the street, around the corner, or just down the street from the main government buildings there in the center of town, is the bus ranks where the combis line up. And the number of combis, for those not from South Africa or from Southern Africa that don't recognize the term combi, we're talking about a minivan, which is used to transport people. Of course, these minivans typically hold, I think 8 or 10 people legally, safely. But of course, like in much of Africa, the combis are filled with 12, 15, or perhaps even more people at times. And the dozens and dozens and dozens of combis that I saw when people were lining up to load up into these things to get home from their work in the center of town at the end of the day. And now I'm picturing Peter Maritzburg with the combis idle and people sitting in townships, people sitting in their residential homes in the suburbs, those without cars who rely on public transport. And I'm feeling for those folks, wondering and hoping that they're doing all right. It is the start. South Africans did have approximately 3 days to prepare for this. Those who were paying attention and had the resources probably were preparing much sooner than this. For instance, I was concerned about this as early as the middle of January, the possibility we'd get out because the Chinese government, Beijing Communist Party, did not seem to be disclosing things from my perspective. I think that perhaps that'll be borne out in the end. But nonetheless, I was a little concerned. I always tend to keep a little bit of things in storage. An old habit from living in Africa. When you can't get something, it's always best to have it already saved away for a rainy day. So I started looking at my personal pantry stores here in mid-January. Bought a bit of this, I bought a bit of that, and made sure that we have what I've got here is what's needed. So I imagine the folks with the means probably did something similar in South Africa. It's not those folks that my concerns and worries go out for, although I worry about everyone, but I would be concerned about the folks who don't have access, don't have that spare cash, who live from paycheck to paycheck, or those who live off of social grants. Now, they'll be allowed to go collect their social grants, so that shouldn't be disrupted. But how do you get to where you're supposed to collect it when there's no public transport? If, as many people do, you live many kilometers away, this could prove to be a challenge. And so I wonder how that's going to be dealt with during this 3-week lockdown. It's unprecedented action taken by the government of South Africa in the interest of public health, to safety, to prevent community spread of the coronavirus. Quite a challenge, quite an interesting, unparalleled situation. So as South Africans embark on their 21-day national lockdown, I posted a video earlier talking about what the government is doing, but we should put out a few positive things to thank some folks. The first of which is one has to look to the family of Johann Rupert and the Oppenheimer family, two famous and incredibly wealthy South African families, who have both pledged to donate 1 billion rand to help small businesses and their employees survive this uncertain time, to help them get through and hopefully not lose their businesses and not cost their employees their jobs in order to avoid something catastrophic. That's incredibly generous of both those families. They certainly have the means, but there was no call for them to do it. No one called on them. No one asked them to do it. They simply stepped up, seeing the country in desperate situation and recognizing that going forward, South Africa needs its workers, it needs its jobs, it needs people to be able to work. And when you shut down businesses like this, no one knows what's going to happen. But it most likely will not be good for a number of employers and a number of companies, which will sadly possibly go out of business. Hopefully, the money that those two families provided will make a difference. The government of South Africa has also kicked in money. I don't know the exact figure. There's conflicting reports, somewhere between 150 and 500 million rand. Whichever the case is, that money will also go a long way towards helping small businesses and micro enterprises, medium-sized businesses survive. Once the department responsible for it fixes their website so people can actually apply for it, which isn't the case right now. So hopefully that gets fixed very quickly. I'm not sure if the problem is the website, the web design, the department itself, the minister, or is it telecom who provides the data links? I don't know. But whatever the case is, folks need to fix that pronto. South African small businesses need that assistance, and many of them won't survive without it. So that's two South African families who've donated some very generous money to help smaller businesses survive. But it's not just those folks who are making a difference in South Africa. We should also point out that ShopRite, South Africa's largest grocer, or Africa's largest grocer, with nearly 2,400 locations around Africa in 15 countries and 147,000 workers. Wow, that's a lot. ShopRite, which also owns the Checkers chain, my favorite place to go grocery shopping in South Africa. But ShopRite has decided, they announced a couple of days ago, and it will be paid on the 2nd of April, to pay their employees in South Africa a bonus, and that's going to be 102 million rand. That comes out to about 5.7 million US dollars, and that will hopefully help employees. This is in addition to those to their salaries. This is a bonus. It's a one-off bonus, kind of like a Christmas bonus early in March, actually April, excuse me. So hopefully that will make a difference for folks, and they'll be able to make that money go somewhere. Of course, not going to be able to do much with that in the short term, because that comes in the midst of a 21-day lockout, a national lockdown, I should say. So ShopRite, the Rupert family, the Oppenheimer family, private individuals, private business stepping forward to make a difference in South Africa. The number of cases yesterday was 702. Today, the 26th, still here in the United States. Now it's the 27th in South Africa, but on the 26th of March, 2020, that number climbed to 927 confirmed cases, with no fatalities across South Africa to this point. Gott sei Dank. Hopefully, that good news will continue with no fatalities. But the number of cases does continue to climb, not as alarmingly as it is in other places, but it may be simply a case of we have not reached the stage where people who've been exposed and infected have become ill. It does take a matter of days for the virus to take effect and make people begin to feel ill. But hopefully that will not happen. If that is the case, we shall see what happens. But the national lockdown, if more people have been infected, which is most likely the case, hopefully if people adhere to the national lockdown and it's effective, which it should be, given the scale and the scope of the lockdown, which is much more draconian than other lockdowns in other places, then perhaps this will halt the virus in its tracks. That's the best we can hope for. But it's not simply separation, folks. It's also, we were understanding from authorities that the virus survives on a variety of sources for extended periods of time. It's not anthrax where it'll survive for months or years, but it will survive for days or possibly a couple of weeks, as we've been told by health authorities. Given that to be the case, and even if it's not the case, who would want to take the chance? Folks should spend a great deal of time doing hygiene or cleanliness of their abodes, their living surfaces, the places where they are at, washing things as reasonable and frequently as possible, cleaning counters, wiping things down, and avoiding the thing that makes most of people sick with this virus, and that's touching your face, your eyes, with your hands, which is, of course, the vector that brings it into your body for many people. So, South Africa, 21-day national lockdown. It is now just quarter after, 15 minutes past the hour, and after midnight in South Africa, as South Africans should now be in their homes, with the exception of authorized personnel. It must be eerily quiet on the streets of Pretoria, of Nelspruit, of Durban, Cape Town, places where we always hear lots of noise and lots of goings on. Must be very quiet in these places now, I would imagine. But South Africans in their homes can have themselves a braai, enjoy themselves. But I ask folks that you're careful and you take care of each other. When people are locked in confined spaces like this for an extended period of time, it can cause undue anxiety, stress, and for families in which the breadwinner is not always home or is frequently away from home, but now is forced to be home with the family, this can create other problems. Of course, I'm referring to alcoholism. That's a possibility. And then related to alcohol, but not always exclusively a result of alcohol, we have concerns about gender-based violence, domestic violence, even incest, and other forms of abuse. So I would ask South Africans, please do your best to refrain from such activity. Love your family, not your friends and neighbors. You shouldn't be seeing them. You should be at a safe distance away from you. But love your family, love your friends, take care of each other. God bless you. And I wish you all the best. We'll get through this, and South Africa's actions may make it possible for Southern Africa to avoid this plague and for South Africa to end sooner. So we'll catch you here next time. I hope you enjoyed this live stream, even though it looks like I'm the only one here because no one knew about it. Take care.